Okay, we're going to get started now. A reminder that this is for press only. If you are currently logged in and you're not a member of the press, or if you're not speaking, please log out and you can watch on one of the live streams that we offer, the Health Department's Twitter feed, which is at PHLP Public Health, has a live stream, as well as PhilaGov TV. You can watch on Comcast Channel 64 or Verizon Channel 40. Again, if you're not a member of the press, please log out and watch one of the live streams. Members of the press, please ensure that your Zoom login name includes your full name and media affiliation. You can do this by mousing over the word "more" in the participants list, selecting rename, and then including your media affiliation in your name. Anyone logged in without listing their full name or affiliation will not be called on. And with that, let us now turn things over to Mayor Jim Kenney. Mayor, you have the floor.
Thanks, Mike. Good afternoon, everyone. As you're all well aware by now, we are in the very dangerous stage of the pandemic. The average number of reported positive cases of COVID-19 per day in Philadelphia has jumped at least 700% in less than 2 months. Let me repeat that. That's 700% jump in less than 2 months. And the average number of new cases reported per day last week was higher than the number of reported cases during our worst week in April. The strains of our great hospitals are already showing. COVID-19 hospitalizations have jumped 600% in the last 7 weeks. So today we are announcing a series of changes to the current restrictions that will be effective this Friday and last at least till the start of the new year. We do not take any of this lightly. And believe me, more than anything in the world, I wish none of this was necessary. But there's no doubt these changes are necessary. We need to act now to reduce the rate of increase and to flatten the curve once again. This will help ease the potential burden on our hospitals. It will help slow the spread of the virus. And most importantly, it will save lives. We put a lot of thought into these new restrictions, which Dr. Farley is going to spell out in a few minutes. I've been part of numerous meetings over the last few weeks after we recognized that further action would need to be taken. They were not easy conversations, and none of us take this lightly. The changes we're implementing this week are based on data and evidence from health and how cases spread. But to be clear, in all these meetings, every single restriction and change was discussed with the understanding that they will impact businesses. They'll impact jobs. They'll impact people's lives. That's why last week, we, along with City Council, announced an additional $30 million for rental assistance and small business relief. This brings the city's direct support for small businesses to nearly $39 million and for rental assistance to more than $39 million since the start of the pandemic. Our finance director and chief recovery officer are working aggressively to maximize every dollar from the original CARES Act and other federal and state supports. We continue to lobby Harrisburg relentlessly for the General Assembly to allocate the Commonwealth's CARES Act dollars so they go to the areas most impacted by the virus, and on Capitol Hill for additional relief, particularly urging Congress to move quickly on a new stimulus package. We hope to bring you more information in the coming weeks on additional relief that may be available. But please know we will have no stone unturned in the effort to help Philadelphians get through this. I believe that we will get through it if we act with urgency like we did in the spring. We flattened the curve then, and I'm confident that if we get past our COVID fatigue and again take this as seriously as it is, we will get through it again. So hopefully these restrictions will only be needed for 6 weeks. And now, Dr. Farley, please.
Thank you very much, Mayor. We've been with the coronavirus now for 8 months, and everyone's tired of it. Unfortunately, the epidemic is approaching its worst. I'm going to lay out the situation. I'm going to lay out the future, which I think is a little grim if we don't take strong action, and what we feel we must do to reduce the consequences. First, a few numbers. Since yesterday, we've identified 654 cases of the coronavirus infection in Philadelphia residents. And since Friday, we've identified 2,564. Now, last week, by the date of sample collection, we averaged 657 cases per day, which is the highest average case count ever. And even that, the numbers are incomplete with delays in reporting. And so I'm sure that by the time that we get all of our numbers in last week, we will average more than 700 cases per day. Now, last week, people tested, 13.4% tested positive, and that percentage positive is also growing rapidly. Since Friday, we've identified 8 additional deaths from the coronavirus, bringing us to a total 1,917 since the beginning of the epidemic. Now, while we're seeing increases in cases and increases in deaths, we're also seeing increases in cases in nursing homes and other congregate facilities where vulnerable people live. I want to give you a better sense of the overall sweep of the epidemic and where we might head if we don't do these restrictions. And to do that, I'm going to try to show you some slides here. I'm having trouble. I can't find my screen to share my slides. Can you still hear me?
Yes, Dr. Farley, we can still hear you, but we are not seeing the screen. Let me just check the settings on my end. You should be able to.
All right, I've got it now. I've got it now, Mike.
We're not seeing it though. We're good now. You just need to full screen. Yeah, perfect. There we go. Thank you.
Right. Sorry for that. This is a graph of the number of cases we're getting reported of coronavirus in Philadelphia residents by week since the beginning of the epidemic. As you can see, we peaked in around early April with the epidemic in the spring wave, but since September, we've been rising at an exponential rate. Now, people use the term exponential growth incorrectly often, but this is truly exponential growth. We're increasing about 4% per day. That means that the number of daily cases is doubling about every 17 days, which means that we're on track to have about a fourfold increase in the cases by December 31st of this year, or more than 3,000 cases per day for just the city of Philadelphia alone. Now, that may seem like an unreasonable projection, but let me tell you that the rates in North Dakota right now on a per capita basis are higher than that, and they're still going up. So that potential certainly exists. This is a graph of the trends and the number of people who are hospitalized in Philadelphia hospitals with the coronavirus. As you can see, that this has doubled in about the last 11 days. And the number we're at here, about 500, is more than we had on April 7th, when we had already shut down the city 3 weeks earlier. So we're clearly on track to exceed the peak of about 1,000 patients in inpatient hospitals that we had in April. And we may totally exceed the hospital capacity of the entire city by the end of 2020. And the question is, how many people will die as a result of this epidemic wave? Well, we don't know for sure, but here are a couple different models for what might happen in the future. We know that deaths tend to lag behind the reports of cases, and they lag behind the hospitalizations. Right now, we're having about 15 deaths per week. These two models, we may have between 700 and 1,400 deaths just by the end of 2020. And those rates, as you see, are still increasing. And the overall estimates are that this spring wave will lead to about as many deaths as we had. This fall-winter wave will lead to about as many deaths as we had in the spring wave, which is 1,700. Let me stop the share here. So the bottom line is this: if we don't do something to change the trajectory of this epidemic, the hospitals will become full, they'll have difficulty treating people, and we'll have between several hundred and more than 1,000 deaths just by the end of this year. Fortunately, there are things we can do now to save some of those lives and to keep our hospitals from being overrun. By keeping people away from each other as much as possible and wearing masks whenever they do interact, we can reduce the spread. Here's what we know about the settings in which the virus is spreading in Philadelphia now. It's spreading within households, among household members. It's spreading during household visits, when friends or relatives visit from one household to another. It's spreading at small social gatherings, when friends get together to watch a football game on TV, or they get together for brunch, or a soccer team has pizza after practice, or parties among college students. It's spreading in larger social gatherings like weddings and funerals and baby showers. It's spreading in restaurants. It's spreading in offices, particularly when people get together for lunch without wearing masks. It's spreading in carpools. And then this is the thing that's maybe the biggest worry of mine, is this spreading a little bit everywhere. About half of people with this infection don't know where they got it from. We know that people are generally very active right now. They get around, they shop, they work, they visit, they meet, they interact with others in many different settings. The data we get from smartphones say that in early April, when we had the shutdown, people greatly reduced the time that they spent out of home and interacting with other people. The epidemic subsided very quickly, but that activity now has returned nearly to pre-epidemic levels. So those are all the different settings that we know, and there are many settings we don't know where this virus is spreading. Now, fortunately, we have models for how we can turn this epidemic around. We know that in the spring in Philadelphia, we closed all non-essential businesses and activities, and the epidemic peaked about 4 weeks later and then fell fairly quickly. But no one wants to have a lockdown like that again. Maybe what's a better model now is what's happening in Europe. Now, France and Spain and Germany and Italy and the United Kingdom all had case rates that were rapidly rising, actually higher than they are in the United States. After some delay, they put in place a group of restrictions. And it varied a little bit from country to country, but generally they prohibited gatherings. They closed bars, restaurants, retail stores, theaters, gyms, and museums. But interestingly, they left schools open. And the best news out of the past couple of weeks is it appears to be working. Case rates are leveling in Germany and in the United Kingdom, and they're falling in France. And that change happened pretty quickly, about 2 to 4 weeks after they put the restrictions in place. So the painful scenario that I just laid out is not inevitable. It can be avoided, but we have to take action now. So we'll put in place restrictions to keep people from different households away from each other. When people do interact, to promote and encourage activity to be outside where there's much better ventilation, and to have people maintain their distance and use masks. We'll put special emphasis on where we know the spread is occurring, all while trying to minimize the harm to the economy and to jobs. So this is our fall and winter version of precautions that we're labeling safer at home. Because while we won't prohibit people from leaving home and interacting, we want to strongly discourage that because it's increasingly unsafe to interact with anyone. So here are the specifics. We will prohibit indoor gatherings or events of any size in any location, public or private. It means no indoor parties, group meals, football watching groups, no visiting between households, no indoor weddings, funerals, baby showers. We know that's a very strong policy, but this gets at the most important sites of spread. And we'll have limits on outdoor gatherings. We'll restrict outdoor gatherings to 10% occupancy or 10 persons per 1,000 square feet. A cap for very large spaces of no more than 2,000 people. That means there will be no fans at football games. And for outdoor gatherings, no food and beverages can be served so that we can ensure that people can and will wear masks. We'll also prohibit indoor dining at restaurants. We know that many restaurants work very hard to follow our precautions, but people indoors gathering together not wearing masks right now is simply too risky. Then we'll restrict outdoor dining to household members only. And as part of that, having the tables be no more than 4 seats. Now, we need help from residents and restaurants on this one. I routinely see groups of people, 6 or sometimes more, young adults, in an outside seating, eating or drinking together. I can't be sure, but I think it's very unlikely that they all come from the same household. What we need to do is to keep this virus from jumping from one household to another. And people mixing without masks from different households is exactly how the virus does that. We can't enforce this, but we are asking residents and restaurants, please, people eating outdoors without masks should be there with their household members only. Now, retail we will allow, but we will have a reduced density of the people in retail stores, no more than 5 persons per 1,000 square feet. This was the density we allowed when we first reopened retail stores. But since then, the stores have generally stopped enforcing that, and we've increased our limit. We're lowering that limit again and asking stores to enforce that limit again. And we'll require stores to enforce mask use in their staff and in their customers. Don't serve or allow anyone to enter into these stores if they're not wearing a mask. And for workplaces, we're saying people must work from home unless it's not possible for them to work from home. Then here are other businesses and activities that are closed, prohibited. We'll close youth, community, and school sports. Now, as an aside here, we know that many teams have been traveling to suburban counties to do those sports. We're asking those teams to please stop doing that. You're putting everyone at risk by doing that right now. We'll also be closing gyms and museums and libraries. Now, what about religious institutions? Those will be allowed to stay open, but with a reduced density, no more than 5% occupancy or 5 per 1,000 square feet. And we encourage all religious institutions to hold their services online only. Colleges and high schools will be prohibited from having in-person instruction. They'll be instructing online only. Now, however, childcare in schools will be allowed, childcare in elementary and middle schools will be allowed to continue having in-person instruction, as well as access centers, under safety protocols that the Department of Public Health has disseminated, in particular with everybody wearing masks and distancing. The reasons are this, that children almost never get seriously ill from COVID, and that education of children is crucial to our future. We haven't lost much if we have to eat takeout food, but we've lost a lot if our children don't get educated. We also know that our essential workers, like medical staff, need childcare so that they can work. And we have the example now from Europe that says that you don't need to shut schools in order to succeed. Those are our restrictions. There is going to be detailed guidance on all these different restrictions and settings, which will be posted on our website tomorrow. Those restrictions are going to be in place from this Friday, November 20th, through January 1st, 2021, 6 weeks. But I want to strongly encourage everyone to voluntarily start these restrictions now, today, so that we can start getting this epidemic back under control. With these sorts of epidemics, the earlier you intervene, the more successful you are. Now, right now, these restrictions apply only to the city of Philadelphia, but they would be much more effective if they applied in the entire Philadelphia metropolitan area. So I'm asking today neighboring counties in Philadelphia, in Pennsylvania, in New Jersey, and in Delaware to put in place similar restrictions. We all use the same hospitals, we interact with each other, we're all in this together. Now, I know these restrictions are tough. People are going to be put out of work, and some businesses may go under. But we also know that the consequences to health of not doing it are really bad. Hospitals can be overrun and unnecessary deaths. And we also know that there are consequences to businesses even if we don't. As case rates and deaths rise, and people see more of their friends and relatives sick and the hospital's getting full, the fear is going to keep people home anyway. And if we do this right, our businesses will recover faster because the epidemic wave will subside sooner. Now, these restrictions are what we in the city can do, but our success depends more on what every resident of Philadelphia does individually. So we're asking for help from everyone. Please stay home, away from others as much as possible. Don't visit or have other visitors, even friends and relatives in your home. Don't go to work unless it's absolutely necessary. If you have to go out, keep your distance from others and wear a mask. Do that for your own sake, as well as the sake of your family members, your friends, and the city as a whole. As I've said, this is a difficult period, but we will get through it. We've lasted with this virus 8 months now. We can last a few more months more. A vaccine will be available in the coming months. We simply need to tide ourselves over until then. Thanks very much.
Thank you, Dr. Farley. And now let's go to Armando for the Spanish language translation of the mayor's and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney para el 16 de noviembre del 2020. Buenas tardes. Como bien saben, nos encontramos en una etapa peligrosa de la pandemia. El número promedio de casos positivos del COVID-19 reportados por día en Filadelfia ha aumentado al menos un 700% en menos de 2 meses. Lo voy a repetir. Un aumento del 700% en menos de 2 meses. Y el número promedio de casos nuevos por día durante la semana pasada fue mayor que el número de casos durante nuestra peor semana en el mes de abril. Esta situación ha afectado a los grandes hospitales. El número de pacientes hospitalizados por el COVID-19 ha aumentado un 600% en las últimas 7 semanas. En consecuencia, hoy vamos a anunciar una serie de cambios a las restricciones actuales que entrarán en vigencia este viernes y que durarán al menos hasta el inicio del nuevo año. No hemos tomado nada de esto a la ligera y créanme, cuánto desearíamos que nada de esto fuera necesario, pero no hay duda, estos cambios son necesarios. Tenemos que actuar ahora para reducir la tasa de aumento y aplanar la curva otra vez. Esto ayudará a aliviar la carga potencial de nuestros hospitales y ayudará también a retrasar la propagación del virus. Y lo más importante, ayudará a salvar vidas. Los cambios que implementamos esta semana se basan en datos y evidencia del Departamento de Salud sobre cómo se propagan los casos. Pero para que quedemos claro, hemos repasado cada restricción sabiendo que afectarán a las empresas, a los trabajos y las vidas de las personas. Por ello, La semana pasada, junto con el Consejo Municipal, anunciamos $30 millones adicionales para asistencia con el alquiler y ayuda para las pequeñas empresas. Esto eleva el apoyo directo de la ciudad a las pequeñas empresas a casi $39 millones y la asistencia con el alquiler a más de $39 millones desde el comienzo de esta pandemia. Nuestro director de finanzas y el director de recuperación están tratando enérgicamente de maximizar cada dólar de la ley CARES y de otros apoyos estatales y federales. Y nosotros continuamos presionando incansablemente en Harrisburg para que la Asamblea General asigne los dólares de la ley CARES de la mancomunidad a las áreas más afectadas por el virus e instamos al Congreso a avanzar rápidamente con un nuevo paquete de estímulo económico. Esperamos brindarles más información en las próximas semanas sobre la ayuda adicional que pueda estar disponible. Pero sepan que haremos todo lo humanamente posible para ayudar a los habitantes de Filadelfia a superar esta situación. Creo que saldremos adelante si actuamos con la urgencia como lo hicimos durante la primavera. Pudimos entonces aplanar la curva y estoy seguro que si volvemos a tomar esto tan en serio como lo hicimos en ese entonces, lo haremos nuevamente, por lo que esperamos que estas restricciones solo sean necesarias durante 6 semanas. Contamos con su apoyo. Y esta es la actualización en materia de salud para el día 16 de noviembre del año 2020. Llevamos 8 meses con el coronavirus y francamente estamos todos cansados. Desafortunadamente, la epidemia se acerca a su peor momento. Si no tomamos medidas enérgicas, el futuro será muy sombrío y estamos tomando las medidas necesarias para reducir esas consecuencias. Primero, vamos a comenzar reportando el número de casos. 654 casos desde ayer y 2.564 casos desde el viernes 13. Solo la semana pasada, clasificando los casos por fecha de recolección de muestras, registramos un promedio de 657 casos por día, el más alto hasta ahora. Estos son números incompletos por los retrasos en los informes, por lo que podemos afirmar que el promedio real es de más de 700 casos diarios. La semana pasada, el 13,4% de las pruebas dieron positivo, y este número continúa creciendo rápidamente. Reportamos 8 nuevas muertes, con un total de 1.917 fallecimientos en total. Reportamos aumento de los casos en hogares de ancianos y en otros entornos congregados con personas vulnerables. Vamos a explicar la tendencia en los casos. El crecimiento es exponencial, 4% por día, es decir, que se duplica aproximadamente cada 17 días. Prevemos que estos se cuadruplicarán para el día 31 de diciembre del 2020. Estamos hablando de 3.000 casos diarios en promedio. Estas son las tasas de Dakota del Norte en este momento y siguen subiendo. En cuanto a las tendencias en las hospitalizaciones por el COVID, para el día de ayer, 494 pacientes estaban hospitalizados por el COVID-19 en los hospitales de Filadelfia. Este número se duplicó en los últimos 11 días. Y es más de lo que teníamos el día 7 de abril, cuando cerramos la ciudad 3 semanas antes. Estamos en camino a superar el pico de 1.000 casos en la primavera en solo 3 semanas. Y se podría exceder la capacidad de los hospitales para fines de este año 2020. El número de muertes proyectadas. Vemos que la enfermedad es menos fatal que antes por varias razones. Pero con tantos casos, aún hay un gran número de residentes de Filadelfia que están muriendo a causa del COVID. Actualmente tenemos 15 muertes por semana, pero 2 proyecciones diferentes de fallecimientos estiman entre 700 y 1.400 muertes solo entre el 1 de octubre y el fin de este año. Se espera entonces muchas más muertes después de ese periodo. Y en general, se estima que los números de esta ola sean similares a los que tuvimos en la primavera, es decir, aproximadamente 1.700 casos. Si no hacemos algo para cambiar la trayectoria de esta epidemia, los hospitales llegarán a su máxima capacidad y tendremos varios cientos de muertes, con más de 1.000 muertes solamente desde ahora a fin de año. Afortunadamente, podemos hacer cosas ahora para salvar algunas de esas vidas y evitar que nuestros hospitales lleguen a su máxima capacidad. Al mantener a las personas alejadas entre sí, tanto como sea posible, y al usar las mascarillas siempre que sea necesario, podemos reducir la propagación del virus. Esto es lo que sabemos sobre cómo se está propagando el virus. Dentro de los hogares. Durante las visitas al hogar, por ejemplo, cuando un amigo o un pariente visita otro hogar. en las pequeñas reuniones sociales, cuando los amigos se reúnen para ver los partidos de fútbol en la televisión, cuando los amigos se reúnen para comer el brunch, cuando los miembros de los equipos de fútbol se reúnen para comer pizza después de su práctica, en las fiestas de los universitarios, en las reuniones sociales más grandes, tales como las bodas, los funerales, los baby showers, en los restaurantes, en las oficinas, especialmente cuando la gente se reúne para almorzar sin usar las mascarillas, en los carpools o viajes compartidos. Hay que recordar que el virus está aún presente en todas partes. Las personas, por lo general, son muy activas. Hacen compras, trabajan, visitan amigos o familiares e interactúan en muchos entornos diferentes. Las estadísticas indican que las personas redujeron considerablemente el tiempo que pasaban fuera de casa a principios de abril, pero que ahora casi han regresado a los niveles anteriores a la pandemia. El uso de la mascarilla en Filadelfia es de alrededor del 80% y esto no es suficiente. Además, a menudo las personas no utilizan las mascarillas adecuadamente. Afortunadamente, nosotros podemos cambiar esto. Durante la primavera en Filadelfia cerramos todos los negocios y las actividades no esenciales. La epidemia alcanzó su punto máximo 4 semanas después y luego cayó rápidamente. Nadie quiere volver a vivir un encierro como ese. Pero estamos viendo un modelo mejor en estos momentos en Europa. Francia, España, Alemania, Italia, el Reino Unido. En esos lugares las tasas de casos estaban aumentando rápidamente y eran más altas que en los Estados Unidos. Pero después del incremento se implementaron nuevas restricciones, que generalmente son la prohibición de las reuniones, el cierre de bares, restaurantes, comercios minoristas, teatros, gimnasios y museos. Pero las escuelas allá continúan abiertas. Las mejores noticias de las últimas semanas son que estas medidas están funcionando. Ha habido una nivelación de tasas de casos en Alemania, en el Reino Unido y van cayendo en Francia. Este cambio ocurrió rápidamente, es decir, en 2 a 4 semanas. Por lo tanto, el escenario fatal no es inevitable. Es algo que sí se puede evitar, pero debemos tomar acciones ahora. Por ello, estableceremos restricciones para mantener a las personas de diferentes hogares alejadas unas de otras, para promocionar y fomentar la actividad al aire libre, donde la ventilación es mucho mejor, para mantener la distancia social y el uso obligatorio de la mascarilla. Vamos a poner énfasis especial en los lugares donde nosotros sabemos que se está produciendo la propagación y trataremos de minimizar el daño a la economía y al empleo. Esta es nuestra versión de las precauciones de otoño e invierno a las que llamaremos más seguro en casa. Porque si bien no se prohíbe a las personas salir de casa e interactuar, nosotros no lo recomendamos porque cada vez se torna más inseguro. Estas son las medidas específicas. Prohibimos las reuniones en interiores o eventos de cualquier tamaño, en cualquier lugar, bien sea público o privado. No se permiten las fiestas en interiores, las comidas grupales, las fiestas para ver el fútbol americano, por ejemplo. No recomendamos y desalentamos las visitas en los hogares. No se permiten las bodas en interiores, en los funerales, en los baby showers. Sepan y entiendan de que esta es una política sólida, pero que llega a los sitios más importantes de propagación. Habrá límites en las reuniones al aire libre también. Restringimos al 10% de ocupación o a 10 personas por cada 1,000 pies cuadrados. No se permitirán contar con aficionados en los partidos de fútbol. Y no se servirán alimentos o bebidas en las reuniones al aire libre, porque nosotros sabemos que las personas para poder beber y comer no utilizan bien sus mascarillas. Se prohíbe el servicio en el interior de los restaurantes. Sabemos que muchos restaurantes trabajaron muy duramente para cumplir con las precauciones indicadas, pero las personas en el interior no usan las mascarillas y esto es algo demasiado riesgoso. Restringimos, por lo tanto, las comidas al aire libre solo a los miembros de un hogar y como parte de eso, las mesas deben tener un máximo de 4 asientos. Necesitamos la ayuda tanto de los residentes como de los restaurantes para cumplir con esto. Habitualmente hemos visto grupos de 6 o a veces más jóvenes adultos sentados al aire libre, comiendo o bebiendo juntos. No puedo estar seguro, pero es muy poco probable que todos pertenezcan al mismo hogar. Necesitamos definitivamente evitar que el virus pase de un hogar a otro. Y porque las personas se mezclan sin mascarillas y son de diferentes hogares, es que tratamos de evitarlo porque eso es exactamente como el virus se propaga. Respecto a la actividad comercial, será permitida, pero de forma reducida. No se permitirá más de 5 personas por cada 1.000 pies cuadrados. Por cierto, esta fue la densidad justo después de reabrir, pero las tiendas dejaron de cumplir con ello. Les pedimos, por lo tanto, a los propietarios de las tiendas que hagan cumplir las medidas nuevamente. La imposición de requisitos en las tiendas impone el uso de mascarillas para el personal y para los clientes, de manera que no permitan la entrada a nadie que no lleve puesta la mascarilla. Acerca de los lugares de trabajo, las personas deben trabajar desde casa a menos que no sea posible. Otros negocios no esenciales y otras actividades están prohibidas y o cerradas. Los deportes escolares comunitarios, los equipos que han estado viajando a los condados suburbanos para practicar sus deportes. Les pedimos que dejen de hacerlo, ya que ponen a todos en riesgo. También se extiende esto a los gimnasios, a los museos y a las bibliotecas. En cuanto a las instituciones religiosas, los servicios religiosos están permitidos, pero con una densidad reducida, es decir, el 5% o 5 personas por cada 1.000 pies cuadrados. Exhortamos a mantener los servicios solamente en línea. Las universidades y escuelas secundarias deben tener instrucción solamente en línea. Con respecto al cuidado infantil y las escuelas, permitiremos que el cuidado infantil se dé mientras las escuelas primarias y secundarias estén abiertas. Los centros de acceso también continuarán abiertos, pero todos deben de seguir los protocolos de seguridad, en particular el enmascaramiento universal y el distanciamiento social. Estas son las razones por las cuales seguirán abiertas. Los niños casi nunca se enferman gravemente por el COVID, y la educación de nuestros niños es importante para nuestro futuro. Los trabajadores esenciales, como el personal médico, necesitan cuidado infantil para poder ir a trabajar también. Y un ejemplo es el que tenemos desde Europa, que nos dice que no es necesario cerrar las escuelas para tener éxito. Estas restricciones estarán vigentes del 20 de noviembre al 1 de enero del año 2021. Pero alentamos encarecidamente a todos a que inicien voluntariamente estas restricciones a partir del día de hoy, y que en este momento solamente se aplican para la ciudad de Filadelfia, pero serán mucho más eficaces si se cumplen en toda el área metropolitana de la ciudad. Llamamos también a los condados vecinos en Pensilvania, New Jersey y Delaware para que establezcan restricciones similares, ya que todos usamos los mismos hospitales e interactuamos a menudo, y estamos todos juntos en esta lucha. Sabemos que esto es muy duro. Sabemos que hay personas sin trabajo y que algunas empresas puedan fracasar. Pero también sabemos cuáles son las consecuencias para la salud de no tomar estas medidas. Además, las consecuencias para el negocio son malas incluso si no aplicamos estas restricciones. A medida que aumentan las tasas de casos y las muertes, la gente ve a más amigos y parientes enfermos y los hospitales se llenan de gente. Y el miedo mantendrá a la gente en casa, de todos modos. Si lo hacemos bien, las empresas se recuperarán más rápido cuando la ola de la epidemia ceda aún más. Estas restricciones son las medidas que hemos tomado para la ciudad de Filadelfia, pero el éxito depende aún más de lo que haga cada residente. Así es que les pedimos ayuda a todos. Por favor, quédese en casa, lejos de los demás, tanto como sea posible. No visite ni reciba visitas, ni siquiera de amigos y familiares. No vaya a trabajar en persona a menos que sea absolutamente necesario. Alentamos al teletrabajo lo más que sea posible. Por favor, guarde su distancia social y si es que sale, utilice su mascarilla, por el bien de los miembros de su familia, por el bien de sus amigos y de toda la ciudad. Este es un periodo difícil, pero lo superaremos. Hemos durado 8 meses luchando contra esto y podemos aguantar un poco más aún. La vacuna estará disponible en los próximos meses, pero necesitamos de su ayuda ahora para pasar esta difícil prueba. Y solo juntos podremos superar esta pandemia. Muchas gracias.
Okay, thank you, Armando. We're now going to move to the Q&A portion for members of the press. And a reminder that we are joined today by Managing Director Tumar Alexander. We have about 30 minutes left for questions, so we will be limiting questions only to the topic of COVID-19 and the restrictions just announced by the mayor and the health commissioner. Only one representative from each media outlet is permitted to ask questions, and reporters are asked to limit their questions to 3 or fewer. If your hand is raised now and you have a question on a topic other than COVID, please. Thank you. And let's start off with Victor Fiorello of Philadelphia Magazine.
Good afternoon. I have three questions. The first is for Mayor Kenny. Mayor, you have the security of a taxpayer-funded job, and obviously the news that you're announcing here today is going to severely impact the lives of and the financial situations for countless people in the Philadelphia area. The city has raised a lot of money in the past for COVID relief. How much of that is available? And are there any new initiatives underway? And what kind of assistance are you able to offer everybody from the owner of the small restaurant to the bartender whose shifts or cuts are eliminated altogether?
Well, first of all, the elimination of anyone's job is extreme difficulty in people's lives. I also think that dying of COVID is an extreme result of not doing what we need to do now to get the curve back down and to flatten it out and get us back to some semblance of normal. Again, we have announced, we have done some money for people who've lost their jobs or are getting evicted. We have a constrained budget to begin with. We've gotten about 6% of the CARES dollars that the state got, with about 12% of the population. So we will be looking to try to get that increased. And we're hoping that that Congress, sooner or later, preferably sooner, will go about providing a bailout package for the American people to deal with this issue. We cannot simply, as a city, handle this ourselves.
Thank you, Mr. Mayor. And the one thing that I asked at the end there that I don't think you've addressed is, are there any new initiatives underway? There are new restrictions. So are there any new fundraising initiatives underway?
Not at the moment. We wanted to get this information out as soon as possible. And we still have opportunities to lobby both Harrisburg and Washington for new money.
Thank you. I have two quick questions for Dr. Farley, please. Dr. Farley, you've announced a bunch of restrictions in different realms and industries. Restaurants have certain restrictions, not theaters. Gyms have certain restrictions. Barbershops have different kinds of restrictions. What is the hard evidence and the hard data that you're using to come up with these new restrictions? Why 4 people are allowed to eat outside, but not 6? Why is somebody not allowed to work out in a gym whenever gyms are wearing masks? Why are people not allowed to watch a performance in the theater when people are wearing masks? Where's the hard evidence and the hard data?
Well, you have a lot of questions then embedded in that one question, but let me just say we're using the best data available to us. The data comes mostly from our interviews done as part of contact tracing. And those interviews are not designed to find out how that person got infected, but rather to prevent infection from spreading to contacts. And we know half the people don't know how they got infected. Then we're also using, evidence from, studies published elsewhere about where this virus spreads. It's very clear it spreads in indoor settings where people are not wearing masks and people are crowded together. And so that those put together in combination with the evidence from Europe is what leads to these restrictions. There's room for judgment, though, in all of this. You're not going to find out a scientific paper that says that 4 seats at an outdoor dining table is better than 6. However, the principle that households should not be mixing with other households is very clear. So we're using that evidence and our best judgment.
And last question for Dr. Farley. If there is spread in restaurants, which you've said there is, you and I have talked about this before, this sort of seeming lack of oversight in terms of restaurant inspections. A quick search of city records makes it quite clear that the majority, if not the vast majority of restaurants, let's just say in Center City, haven't even been inspected. I'll point to Vetri, who's a very outspoken critic of the administration. His restaurant hasn't been visited since before the shutdown. Do you take any accountability here in terms of the gyms, the restaurants? If there is spread in those places, shouldn't they have been monitored more closely and inspected more regularly or at all?
Well, we do 2 types of inspections. One of them is just a routinely scheduled inspection, and those are a little more frequently than once a year. And then we also do inspections based upon complaints. Someone tells us that there's something that they are concerned about. And so with that, we get to as many restaurants as we can. We know we don't get to all of them. There are thousands of restaurants in the city, and we have something like 50 inspectors. So we do the best we can under the constraints that we have. And we ask for cooperation when we don't have the ability to inspect.
All right, thank you, Victor. And reminder that we have very limited time, a large number of folks with questions. So we Would appreciate if you could keep your questions as concise as possible. We go now to Joe Holden of CBS 3.
Good afternoon, everybody. Mr. Mayor or Dr. Farley, can you describe the lead-up process to pulling stakeholders in to describe the new list of restrictions? I know over the weekend we were all trying to sort of get our hands on things. What were those discussions like, and can you describe both the pros and the cons of what you heard at the table?
Doctor, if you don't mind.
There were discussions we held internally among city officials about what restrictions made sense based on the information we had available to us. And then we had a conversation on Friday where we talked to a number of stakeholders and presented our proposal to them and got feedback. We asked them to keep that in confidence, but many of them did spread that out, and so that's how you heard about it. But it really was, that one conversation with regarding these restrictions. And that happens in a context of there are ongoing conversations between us and industry representatives. But it was that one conversation about these restrictions.
Thanks, Doctor. Mr. Mayor, talking about the holidays coming up, I know the restrictions are 5% for houses of worship. Your message to people as they would want to celebrate Christmas, Hanukkah in the synagogue, in the church?
I mean, you certainly have a First Amendment right to do that. God can hear you from anywhere. So, prayer does not necessarily have to be conducted in a building. You could do it at home. But you're taking a chance of exposing yourself or others to a deadly disease. That would be a choice that you'd have to make.
And my last question, Victor sort of summed it up as well in one of his questions, but to the bar owner, the tavern owner, Kite and Key, one of the folks we spoke with today, don't think they're going to make it after this second round of restrictions. What's your message to a business owner like that, Mr. Mayor?
Well, we hope they do, and we will do our best as things change to get some additional support to them or for that industry. Again, we're struggling with a budget deficit of our own, a school budget deficit. The state is holding on to money. The legislature has not appropriated all the CARES Act money, and Congress is still squabbling with each other. So we're doing our best from our end, and whatever resources we have, we will try to funnel it to those folks.
All right,
thank you for your time.
Let's go now to Johan Calhoun of Chalkbeat.
Yes, I have three questions for the mayor and for Dr. Farley. Can you or Dr. Farley provide us with numbers of school-aged children infected with the virus?
I don't have them, Doctor. Do you?
Yes, we can provide that. Much of that information may already be on our website, but we can give you the number of school-aged children with the virus. That doesn't mean that they got it in school, though.
Johan, if you email us, we can get that for you.
Okay, will do. What's the status of student access centers now that the city's students are continuing with remote learning because of the growing COVID rates? Do you plan on adding locations, expanding hours?
I don't believe there's a plan to add locations, but we'll continue operating the ones that we have. That I've been to two of them, and they're running quite successfully.
Okay, and can you provide us with an update with Connect Ed? There were some concerns in the early stages of the pandemic that the population the city was targeting to help was not participating.
We're continuing to do that outreach. It's difficult to get people to sign up for things. People are they're skeptical of the government. They don't want if their documented status is different than other folks. They don't want to reach out to us. So we're doing our best to do the outreach and to get the equipment and the wiring to everyone possible.
Thank you.
And a reminder to all you folks, if you want to ask a question, you need to indicate by using the raise your hand function, not by putting the question in the chat. Let's go to Brandon Hudson of NBC 10.
Normally, it says lower hand, but where is my...
Brandon?
Hey, you got me?
Yep, go ahead.
Hey, good morning or good afternoon. First question is, with the Christmas Village that is set up, I know that they had their own restrictions, but this kind of comes after that. So what would this mean? Because I know the city is helping out. They put this on with Love Park. So what does this mean as far as visitation by people heading to the Christmas Village this year?
I think there was updated safety plan, and I think Dr. Farley's aware of it.
So the Christmas Village will still operate, but we put in place some safety precautions already before they even started to open. But we will look and probably put in place additional restrictions in the wake of these to be consistent.
Second question is, what is your message to people as they're getting ready? Because, as you know, Wednesday before Thanksgiving is one of the biggest holidays where people try to get together, go see some people. And I know that the message has been try to avoid that. But how do you reach out to these people, to the bar owners, to the restaurant owners, to make sure that they kind of fall in line and respect your wishes?
We'll keep on doing outreach to them. As I think one of the national doctors said, that if we do what we're supposed to do now, this next year's holidays will be certainly different than they are this year. It is 1 year in a very severe situation that we're asking people to cooperate. And I like to go out too, but I just can't do it at the moment.
My last question, we spoke to a fitness studio owner on Saturday. He said that he feels that it's a bit unfair to be lumped in with a lot of the other gyms like a Planet Fitness and like a lot of these gyms that are backed by corporations. So what would you say to a fitness studio owner or a martial arts studio owner that says they've had no customers test positive, but they don't think they should close because they've been following the precautions and their operation is different from how most gyms operate?
Doctor, you want to take that?
I would just say, and I know a number of gym owners are unhappy about the closure, and I'm sympathetic to them. On the other hand, we do think a gym is at risk where people are indoors, breathing hard, a lot of air going in and out, opportunities for the virus to go in and out. To say, well, we don't know of a case in our studio doesn't necessarily mean that there isn't risk to that overall sector. We do think that this virus in general is spreading a little bit everywhere. And so we need to restrict activity in order for us to get the virus under control. And people can exercise outside. So I'm sympathetic to the gym owners. They're important business people in the city. We will get past this, but right now we feel like it's just too risky.
And it's just 6 weeks, right?
Thank you. Hey, Brandon, yep. We have very little time left and a lot of folks with questions. So I'm going to move on now to Kennedy Rose. Folks, unfortunately, because of the limited time, I'm going to ask you to limit it to 2 questions for now. So let's go to Kennedy.
Hi, I have 2 super quick questions for Dr. Farley. The first is going back to Christmas Village. Will those same restrictions that you outlined, no eating or drinking in outdoor events, does that still apply?
We are going to put additional restrictions specifically around food at the Christmas Village. We'll work out the details and communicate with them.
Gotcha. And with the no more fans at football games or shrinking the capacity for outdoor events, was there any evidence of spread at outdoor events, or is this just a precaution more than anything else?
Again, that's why I'm emphasized the idea that this is probably spreading a little bit everywhere, and we know our example of when people stayed home, the virus went away, and so we think it's inconsistent with our message to stay home to allow very large events and very large gatherings.
Okay, thanks very much.
Thank you, Kennedy. Let's go to Annie McCormick of 6ABC.
Hi. What are you going to do in regards to enforcement? This is now the second time around. There may be some businesses we've talked to actually that have said we're going to stay open. We have no choice. Otherwise, we're just going to close. And just part B to that as well. Actually, just answer that. I'm sorry. What would the enforcement be?
Well, we expect to enforce as we did in the first round of lockdown. And I know people are going to try to push the envelope, and we would like them to cooperate and not push the envelope. But based on complaints or information that we get from the public, we'll visit those establishments and get them to shut down.
In regards to the CARES funding that expires on December 31st, I know that the Democratic caucus had already outlined a plan, what they were hoping from the governor. Obviously, this announcement today dramatically changes what the need might be. Did you have any discussions with the governor over the weekend specifically about that CARES funding?
Not over the weekend. We've had general conversations about the percentage of the money that the city got based on the percentage of its population and the percentage of the infection rate.
Okay.
And he's not, governor's a terrific guy and he works well with us. He's just not in control of either house of the legislature.
But he is a good person to lobby. He is a good person to lobby on your behalf up there in regards to well. So I'm just wondering where his head was at too.
I haven't talked to him over this weekend. No.
And one other question. We are also hearing that the governor is going to be making an announcement sometime this week in regards to additional closures. Does Philadelphia kind of setting the tone for what we could see across Pennsylvania?
We don't know what those changes are going to be, and basically we're just trying to respond to the case outbreak, the hospitalizations, the deaths, and the population density.
All right, thank you. We're going to go to Laura McChrystal of the Inquirer.
Hey, Dr. Farley, you said that, for several weeks now, the majority of spread appears to be at private social gatherings that people are having. I know you're now banning them, but enforcement of that seems impossible. So are you hopeful people will follow that and it will work?
Yes, I'm hopeful that people will follow that. And we know it won't be 100%, but that many people will. I think many people did do that in the spring, and so they can do that again now.
The bottom line is, though, people don't follow it and it doesn't work, we're going to be in the situation longer than we need to be. So it'll be a self-fulfilling problem if people won't cooperate, refuse to follow what we're asking them to do, and the case count keeps going up. We'll be in this same spot next year.
Okay, and my second question is a clarification on the guidance for office workers. I know it's saying that they should work from home unless not possible, and I know since we moved into the green phase, it was that while they were permitted back, that they should work from home if feasible. So is that mandated that offices send people back to remote work now?
Yes, and I have a look at the wording, exact wording, executive order, but the basic message is that while there is judgment on the part of the business owner or the worker as to whether they can do their work from home at all, it's very clear now, if they can do their work from home, that they should.
Okay.
Thank you, Laura. Let's go to Sherry Darden of Scoop USA. Sherry, you'll have to unmute yourself there. Try it one more time.
You hear me now?
Yes, go ahead, Sherry.
A couple of questions. One for the mayor. With regard to city offices and the testing sites, the city sites, are they still open? And the courts?
City testing sites are. The courts, I think, we're still in discussion. They wanted to go back to kind of jury trials and civil cases and stuff. I think that this new information may slow that down. And the city business that needs to be done will still be available. I would ask people to do as much they could do online.
Okay, and this question is for Dr. Farley. With regard to the virus itself, has it been noted, or can we know whether or not it's mutated and it's changed? Like, why are the numbers going up, and is it impacted by the flu?
Well, there's no reason to think that this virus is any different than it was in the spring. However, the virus is the ratio between the number of cases and the number of deaths has changed for several reasons. One of them, we're testing more, so we're picking up people who don't have symptoms. More of the cases are occurring in younger people who are healthier, and so that the may have fewer deaths per case than we had in the spring. Still, we have many, many more cases now than we had in the spring, and so the number of deaths is substantial. But it's the same virus we had before.
Okay, and sorry, rapid testing, is it in Philly? The rapid
testing is available in some places. It's not to a great extent. We hope to gradually increase that availability.
Thank you.
So, folks, we only have 5-6 minutes left. We have many more questions than time allows. We'll get to everybody that currently has their hand raised, but that's it. So let's go now to Alan Yu, WHYY.
Hi. First question is for Dr. Farley. Do you have more details from contact tracing interviews about, for example, how many cases come from gatherings or restaurants or things like that?
No, our contact tracing interviews are not designed to figure out where that person got infected. That would be very difficult, if not impossible to do anyway. Our contact tracing interviews are mainly designed to try to prevent that spread of infection to others. Now, we do learn information, though, that can be helpful because there are some people who know where they got the infection from. And so that is where a lot of our information comes. But most of the time, at least half the time, the people who we're speaking to don't know where they got the infection. And so much of the time, we don't know where that infection was spread.
Okay, and the other is, I guess, a clarification around the regulation on the commercial capacity. If it's 5 per 1,000 square feet, does that include both workers and the customers or clients?
Yes.
Thank you.
All right. Thank you, Alan. Let's go to Mike Donofrio of the Tribune.
All right. Yes, if the pandemic worsens over the coming weeks, is the administration considering at all putting in place a stricter shutdown or a full shutdown of non-essential businesses as it did in the spring?
Anything is possible if the numbers keep going bad. We're trying to do this in increments so that we can bring down the numbers without being so overwhelming.
And how do you expect maybe this second partial shutdown to negatively affect the city's revenues and budgets?
I don't have a specific estimate of that, but we probably could do a napkin, calculation. I don't know if Rob's on or he knows what those numbers are yet, but it's certainly.
Mike, if you can email us, we'll try to get that for you.
All right, then maybe just generally, I mean, are you worried at all that this partial shutdown could potentially impact the city's budget more than originally planned?
I worry every day about everything.
All right. Thank you, Mike. Let's go to Dan Gallo of MSNBC. Dan, you have to unmute yourself.
Sorry about that. My bad. Mr. Mayor, I know you talked about enforcement in terms of restaurants and businesses. Can you just go through the enforcement mechanisms? And, are there penalties for violators as it results to indoor gatherings at private residences? That sort of thing?
Dr. Farley, could you please walk through that?
Yeah, so at restaurants, our enforcement tools can range from fines to closing restaurants. As far as private gatherings, we'll not be enforcing that. We're clear about that. However, we have the order written there to really send a strong message that people shouldn't be doing that.
Dan, if you have a follow-up, you have to unmute yourself again.
I don't have a follow-up. Thank you.
Okay, very good. Thank you. Let's go to David Melandra of Philly Sports Network.
My question is for Dr. Farley. As we know, during the Thanksgiving holiday, the big thing is high school football games. So are you saying no high school football games for Thanksgiving this year?
Yes.
Secondly, the NCAA is supposed to be starting their college basketball season next week. So for the Philadelphia teams, are you saying don't play their games in the city or no fans at all?
So the college and professional sports teams, we have negotiated and we'll be discussing safety protocols for the teams themselves, but they wouldn't be able to have spectators.
And finally, actually, you answered my question. Thank you.
All right. Thanks, David. Let's go to A.D. Amorosi of Philadelphia Weekly. A.D., you have to unmute yourself. A.D., there you go.
There we go. Thank you. Sorry about that. I am curious as to what do you anticipate will be the relationship with public transportation? Are there any changes afoot?
Public transportation is allowed. We're not going to prohibit public transportation. Certainly, mask use is something that strongly encouraged and required. We'll have to figure out the enforcement on that. But public transportation is essential, so we're not going to prohibit that.
And how do you intend to relationships with banks, pharmacies, grocery stores? How do are these considered offices? Are these considered essential buildings? How are we looking at this?
Those are like retail stores, and so they're allowed to continue operating under this reduced density limit. And we're asking for their cooperation in enforcing that density limit as well as masking.
Thank you.
Thank you, A.D. Let's go now to Isabel Sanchez of Telemundo.
Hello, Armando. Mi pregunta inicialmente es algo que ya mencionó el alcalde, el doctor Farley, pero no necesitamos en español. Entonces, ¿cuál es ese mensaje para dueños de negocios pequeños, barberías, restaurantes pequeños que sienten que no tienen opciones ahora que se vuelven a instituir estas restricciones?
This is a message that's already been given in English, but we need it for our Spanish-speaking audience. And my question is for the mayor, what would be your message for the small business owners, the barbershops, the restaurants, who have no choice now but to comply with these new restrictions?
We're hoping with these restrictions that we'll get the curve of the disease down to a point where we can go back to opening up again, back to the green phase. It's not something we obviously don't enjoy doing this, but we cannot ignore the numbers, and we have to take these precautions in order to again get us back to a healthy situation.
Estas restricciones tienen como objetivo el tratar de aplanar la curva y tratar de abrir nuevamente como lo tuviéramos en la fase verde. Obviamente nosotros no disfrutamos de hacer esto, pero no podemos ignorar las cifras y los números que tenemos y tenemos que tener paciencia para poder tomar esas precauciones y volver a una situación de salud.
Muchas gracias.
I should be clear, though, that we are not prohibiting barbershops from operating with these restrictions.
El comisionado Farley nos dice que las restricciones no incluyen el restringir las actividades de las barberías.
Pero incluirían entonces reducir el número de clientes, dado el tema del espacio.
With the restrictions on space would include reducing the number of clients that barbershops can service then.
Barbershops are required to operate on appointment only, so that people are not waiting there, and so that's the way of reducing density there.
Se obliga a las barberías a tratar de atender a sus clientes y no tener gente en espera que estén acumulados en el espacio. Entonces solamente atender a las personas que están recibiendo servicio en ese momento.
Thank you so much.
All right, thank you, Isabel. Let's go now to Carolina Rodriguez Plaza of Univision.
Hola, hi everyone, can you hear me?
Yes. Sí, Carolina, buenas tardes.
Buenas tardes, Armando, hola. Sí, quisiera preguntarle o reafirmar al comisionado Farley y al señor alcalde, lo que están anunciando hoy son restricciones, pero no se ha anunciado una orden de quedarse en casa o también aplicaría.
I would like to just once again have this for our Spanish-speaking audience, both the mayor and Commissioner Farley. What you are announcing today is only restrictions, but not a stay-at-home order. Is that correct?
Yes. We'd like people to stay home as much as possible.
Preferimos que la gente se quede en casa lo más posible.
Okay, perfect. That's all for me. Thank you.
Thank you.
Thank you, Carolina. Let's go quickly to Martin Pratt of Philly YBN.
This question for Dr. Farley. How are the numbers at senior living facilities?
I can't give you numbers, but I can tell you that we are seeing a number of outbreaks occurring in a whole range of facilities where seniors live together in congregate settings, nursing homes, personal care homes, and assisted living facilities.
So that's an increase from last week or 2 weeks ago?
Yes.
Okay. And this is a question from Mayor. What would you request of Philadelphia citizens to help push along? We know that Philadelphia citizens answered the call to get the vote out. What would you request of Philadelphia citizens to push Congress along to get the stimulus packages done?
Our local folks, for the most part, are supportive of getting a deal done. We just continue to pressure both your state legislative officials and your U.S. legislative officials to tell them we'd like to see some action.
Thank you.
All right, thank you, Martin. Let's go to Denise Clay of the Sunday Sun. Denise, you have to unmute.
Okay, thank you. My question is for Dr. Farley. When will you, what are you looking for in terms of numbers to let you know whether or not to expand this this current set of restrictions? What numbers are you looking for in terms of cases going down?
The most important number is just the number of daily cases. And again, we're increasing out 4% per day. If that goes down, that's a good sign. And then ideally, the increase would level off and we would be having a steady case count or decline. So that's the key number we'll watch.
And is there any date that you have given yourself to say, okay, by this particular date, I'll know whether or not we need to expand this or cut it off on the first? Is there any date that you've given yourself, like a date certain for that?
No, and I could say that the earliest I would expect that we would see a benefit to this would be in 2 weeks, and that I would be hopeful that we would see a benefit in 4 weeks.
Okay, thank you.
All right, we are past time, but let's try to squeeze in those who have their hands raised. Perla Lara of Impacto, do you have a quick question?
Yes, es para también nuestra población en español. Sabemos que las mascarillas no se están utilizando bien. ¿Me escuchas?
No, Perla, ¿puedes empezar otra vez, por favor?
Okay. Que sabemos que las mascarillas no se están usando muy bien, o sea, que es algo que a nivel mundial se sabe que no hay un uso apropiado de las mascarillas, que esa es una de las cosas que realmente podemos hacer hasta el momento. En otros lugares, aquí mismo en Bucks County, están proveyendo de estas mascarillas que son un poco más útiles que otras, que las de tela y demás, gratuitamente a la gente en las calles, en los centros donde se acumulan las personas, etcétera. ¿Hay alguna forma en que, sobre todo porque son costosas, por eso la gente pues prefiere tener una mascarilla de tela? ¿Hay algo que la ciudad esté haciendo para hacer esta entrega masiva de mascarillas y de gel antibacterial, etcétera, recursos que pueden ayudar?
Perla, we are out of time, so we really need a quick question, okay? We have other people with questions, so please.
Creo que tengo tus preguntas, Perla. The issue here is the improper use of the masks. A lot of people are not wearing them well, and this is something that happens worldwide, but there's some examples nearby in Bucks County specifically where they're supplying masks that are better than the cloth masks, which apparently are not all that useful, and they're providing them for free. Part of the issue of not complying with wearing of the masks is that they're costly. And is there any way or any plan from the city to issue masks for the public for free alongside with disinfectant gel?
Doc, are you aware of any plan to do that?
The city has distributed some masks in the past. I'm not convinced that the cost of the mask is the major reason why people are not wearing masks. I got a box of 10 for $8 some months ago. I think that the bigger issue is just people need to be reminded to wear them and to wear them correctly.
La ciudad en algún momento sí distribuyó las mascarillas, pero no estoy consciente de que el costo sea una de las razones por las cuales no se estén utilizando adecuadamente. Yo he comprado 10 mascarillas por $8 hace unos meses y queremos que la gente las utilice correctamente.
Thank you, Perla. Let's go to Matthew Rothstein of BizNow.
Hi, guys. So two quick questions. One, where did the time frame of 6 weeks until the restriction come from? And also, how would you judge the compliance levels of non-restaurant retail businesses back when this level of restriction was imposed the first time post-lockdown?
And as far as the 6 weeks, we saw in the spring that it took us 4 weeks from the time that we did the shutdown till we peaked. And it was more than that for it to get down. We know we have to get through some portion of the winter before this virus starts to subside on its own. And we know we need to get into January before the vaccine is available. So this will tide us over, we hope, until the peak of this, but where the rates would still be high even if we're successful. But to maybe where we're close enough to where we could ease back because we know the vaccine is coming soon. And I'm sorry, the second question?
Matthew, can you unmute yourself again?
The second question was regarding compliance levels for non-restaurant retail businesses. How do you think that those businesses did in the initial reopening phase after lockdown when the restrictions were the same as they are going to be imposed on Friday?
I think that the retail stores initially did well with that, just from my own personal experience, that they prevented people from coming in the store. They counted how many were there. And over time, that broke down. And so we're just asking them to get back to that procedure.
All right. Thank you, Matthew. And we're going to go quickly to two more, starting with a guy I know is always quick, Jeff Cole of Fox 29.
That's me. That's me. That's me, always quick. For Dr. Farley. Dr. Farley, here's the restaurant industry's take on what you've announced about indoor dining.
that to close the indoor dining, which is of course still limited, but to close indoor dining is to push people into settings where it's in fact more dangerous, where there'll be no enforcement at all of mask wearing.
Yeah, you know, that's always the argument as well. If you don't let us do this thing, then they'll do something else, which is riskier. I don't think there's evidence for that. I think if people can't dine at a restaurant, then they're more likely to eat at home, and that's safer.
But you're trying to restrict gatherings in private settings. Doesn't that sort of back their argument in some ways?
No, because I think that they'll be eating at home with their families and not eating at home with other people. It's mixing with other households is riskier, and being any place where you're not wearing masks is a risk to some people in the tables around you.
Last question for the mayor. Hey, Mayor, what portion of this increase in cases is due to the unrest in the city over recent violence or the demonstrations regarding the vote count?
I don't frankly know at the moment. As we get further on into this and have more opportunity to test and trace, perhaps we'll have a better idea of what impact that had.
Thank you.
All right. Thank you, Jeff. And finally, Corey Clark of PCN. Corey, can you unmute?
Thank you. Yes. Very quick, very specific. How does this affect St. Joseph's Prep? They have a playoff game scheduled this weekend. The game is scheduled to be played in the burbs, but do they have to worry about any restrictions?
I don't know about that hybrid, doctor, but I know if they're playing in the city, it probably would not be the case. But if they're playing in the burbs and the burbs haven't changed their situation by then, I don't know.
So these restrictions only apply in the city. We're asking for sports teams to not go to the suburbs and have those games and the risk around them.
Corey, did you have a follow-up?
Nope, I'm good. Thank you.
Very good. Thank you. And thank you, everyone, for joining us. We do anticipate having a second COVID-specific press conference on Zoom later this week. The date is to be determined, so we will put that information out by advisory. Thank you.